So my name is Dr. Tim Gray Sr. I'm a family practitioner, board certified, and been practicing for 40 years, doing the old paper chart. So when we got the chance to do a medical record, this actually is our second one. We tried this once before and it didn't work very well. So we had a chance to work with Centricity. We were really nervous about this, like how do you do this and how will it go compared to what we tried before? The way I look at this is that Centricity threw us a lifeline when we were literally drowning in paperwork. We were pushing around carts, 6 or 7 carts with 20 and 30 charts on every cart every day. We had people hired that just move carts around. So it's been a real blessing for us. So we've been working with HealthCo for about 5 years now. We started in December with the front office 5 years ago, and then we worked with the back part of the medical system after that. But we've had just a great experience. We've gone to HealthCo for training. They come out for training. They work with us. They're there 24/7, I guess, whether they want to be or not. It's just, if you call them, somebody answers the phone and helps you work through the problems that you have. It's just been a real blessing for us. We are delighted. Of course, my biggest concern was we had an EMR once and it completely failed. It was a touch screen where each thing you did, you had to touch, which took so much longer than clicking, or just marking down things or even writing. So after about 2 days on a touch screen, most of us were ready to touch screen with our fist. And a few people did. The computer didn't work quite as well, but it just was nearly impossible to use. We had 1 hour of training for the entire clinic, and they were just going bonkers and it didn't work. We gave up after about a month. But working with Centricity, we had training for 4 months before we started, all the way through. Everybody's here from Centricity and HealthCo to help us the first day. If anybody had trouble, they just sat down and worked next to them. I think that was the biggest thing when we spent time up front doing all the preparation for this, because they say, well, what do you want your charts to look like? I have a son that worked in a different medical clinic in another town, and he said their chart just looked different. It was Centricity, but that was what they chose. That's how they wanted it. So we designed it just the way that we wanted it, and it's been perfect and functional. But without that preparation, those 2 or 3 months of prep and answering this and figuring this out and writing this down, the first day would have been very challenging. About the 4th day, we got back to full production because we found out they were giving us all this extra time to get our charts going at the beginning of the first couple of days, and you found that you didn't need it. So the oldest people are the ones that seem bothered by it the most. So people that are 80 and 90 years old really don't like computers. They don't have one at home. They don't carry a smartphone. They aren't interested in being electronically connected. So for them, it bothers them a little bit. But I took typing classes when they were called typing before it was keyboarding. And so it's not really hard for me to be just looking at the patient and talking to them and doing the typing at the same time if I need to type something in. So it really doesn't bother me. The few people that are bothered are offended a little bit. I said, but look how easy it is to find something. I said, you had a question on when was your mammogram done? We got exactly the date and where and when, and the results in 2 seconds. Things that we used to leaf through the chart for hours for trying to find. And so a few of them have been a little bit bothered. I just think it's a wonderful boon to productivity, and the quality of our care has gone way up because you don't forget things. We have to set the computer up so that it runs through all the pages that we want in the order that we want, and we don't forget things that need to be done. The amazing thing about the office since we changed Centricity is that it's peaceful. We're busier than we've ever been over the years and years. We've actually cut our waiting room down by 1 size because people don't wait there anymore. We've taken out 8 chairs because the average wait time is like 2 minutes. If anybody waits 5 minutes, something's really wrong. So no one ever has to wait that long. The whole system has changed, and patients walk in the room, they never quite get the magazine page all the way opened, and we're in there. They say, oh my gosh, you must not have any patients today. We say it's just swamped today, and they can't believe it because we run on time. So it's made us so functional, so oriented, and we don't feel like we're so stressed all the time that we're opening a satellite office in an adjacent city. We're opening that in the next 3 months. Because we have the system already working, you can open a new office. You don't have to have all the computer people there. The computers are here and they're working over there just fine. And so you have to have less staff, and you can be just as organized and on time. think about using Centricity, the thing that surprised me the most is really that we can manage people with chronic problems now, like our diabetic patients. About 10 years ago, we joined a group in Oregon that was trying to do some diabetic research and trying to figure out how to improve diabetes care. And so we were carrying cards around in our pocket with all the information to check on patients every time, but you couldn't find their old information or where they were, and you couldn't draw trends. And so with the programs that we have now, we're surprised we can manage chronic care without such a struggle. We develop a plan for the patients. A plan is in there. You say, what's the plan for this person? You click back 2 clicks, you see what the plan is. If you want to change it, you make a change. You print the plan off, they look at it, they agree with it. It's very helpful. When you're doing these primary care, patient-centered medical homes, you have to be able to deal with chronic issues that these patients have. And now we have a way to do this. The program lets us do this. We can design it the way we need to. And the companies that are running this are saying, okay, you need to come up with 2 or 3 new programs that you're implementing all the time, all year long. And so we're able to do that and still keep track of the ones that we have because we have the goals written down, we have the system to follow, and the patients like it because they know they're getting better care. Again, I think the exceptional care that we're trying to provide comes down from these programs that we're getting involved in. One interesting one we've recently been doing for about the last several months is trying to increase our mammography rates. So we have patients that come in for a first office visit and you ask them when was your last mammogram, they can't remember, you get one scheduled. So we've had several cases of very, very early breast cancer that have been discovered that wouldn't have been discovered. And so part of these programs that you're coming up with that can be managed by Centricity allows you to do this. When was your last one? Well, we've got this health maintenance form. You know when our last one was. If there's nothing in there, it's been a long time ago. I think if we're thinking about what would you say to a new person that wanted to try Centricity is that, all of us were scared to death. First you have to pay for it. Then we had one EMR that already failed that we couldn't seem to make that one work. So was this one going to work? But we did so much prep ahead of time. We had so much education from HealthCo ahead of time that we didn't think we could fail. And we couldn't fail because the day that it started, everyone's there to help us to succeed. And it's been like that ever since then. So this is one of the best experiences we've ever had.